And my next guest is a plastic surgeon who's made it her life's mission to help clients avoid facial plastic surgery. Joining me now is Dr. Sonita Sadio. Hi, Dr. Sonita.
Hello.
How are you? Thanks for being here.
Thanks for having me.
Oh, it's a pleasure. All right, so let's get right to it. Plastic surgery. Tell us about it.
Okay, so I am a plastic surgeon.
Okay.
Fully trained. I did my training at the Massachusetts General Hospital, at the Harvard Hospital up in Boston. And then I went on to Mayo Clinic, where I did my plastic surgery training.
Very nice.
And then from there, I did an aesthetic fellowship. A few people do actual fellowships in just aesthetic surgery after plastic surgery.
Okay.
And I did that at the New York Eye and Ear Infirmary in Manhattan.
Wow.
Yes.
That's
so
great.
that was my process through training.
Okay. So tell us about Sub Rosa.
Sub Rosa. So Sub Rosa is my practice.
Okay.
And it's unusual in that it's a membership-based practice.
Okay, so it's different than the other types.
So I got out of training and finished my fellowship, and I was seeing clients in the office, and I was feeling like the approach to aging or anti-aging was really about one-offs. Okay. So it was about, I'm going to my daughter's wedding, and in 6 weeks, what can you do? Can you fill this line for me? Okay. Or I want to be fresh for the holidays. Can you do a little Botox for me? Okay. And I was starting to feel that what women in particular were missing was a strategy. How do you approach your anti-aging plan? Okay. Because it's, that's a 360-degree approach that involves skincare, everything from sunscreen, skincare, all the way up to the minimally invasive, all the minimally invasive procedures, lights, laser, Botox, collagen stimulators. There are an array of tools that one needs to employ in order to have a really great strategy. Okay. I like to talk about the toolbox. Right. So I've got a toolbox, and Botox is a screwdriver, and my collagen stimulators are a hammer, and my laser is a wrench. Right. I can't do the whole. You can't do the whole project with one tool. Correct. And I think the approach, what I saw, which was what I was trying to address, was the one-off approach and the what's hot now approach. That's the other part of it. Is what's trending, this new facial, that new, laser, and then everyone kind of runs to get that. But really, these are all tools, and it's really less about what tool is being used and more about the strategy. Right. You want an architect on board. That's right. That's right. Not just someone turning a screwdriver.
So is there anything wrong with aging? Is that?
No, absolutely not. Absolutely not.
But we seem to be obsessed about it.
That's such a good question. Aging is beautiful. Right. Aging is about wisdom, and it's about becoming your better self each and every day. And I think that it's so important to understand that what we want to do is to age. Everyone talks about aging graciously, right? It's kind of a cliche. What does it really mean? Right. What does that mean? To me, aging graciously is about, number one, looking like yourself, looking like your relatives, continuing to do so, but to keep the negative emotions from aging off of your face. Okay. So people think about wrinkles. It's not about wrinkles. Right. As you get older, there are certain emotions that get etched onto your face. Okay. So the lines here make you look concerned. There's that line here makes you look concerned. Right. Hollowed out under eyes make you look tired. Right. Deep lines here, deep lines around the mouth make you look a little angry. And then we get a little jowly under here. And the whole thing, it becomes this kind of emotional cocktail of just angry and sad. Right. So it's not so much about wrinkles and looking like you want to be 25 forever. But I don't know many people who even want that.
But it even looks fake though when you see it, right? You see some of these celebrities, I guess, that you see them like, oh my God, what's wrong with her face?
Exactly, and that's what you want to avoid. It's about looking, number one, you don't want mismatch. Right. You don't want the overdone Botox forehead, and then the forehead of a 20-year-old, and then the lower face of a 55-year-old, because the eye reads it as odd.
Oh my God.
Other people will look at that and say, something's not right. I don't know what it is, but something's off. Okay. Right, so you don't want mismatch, you don't want overdone. And I actually encourage people to keep certain features of aging. Okay. Like crow's feet, I've gotten much more conservative. Crow's feet are the little lines around your eyes.
Like I have here.
Yeah, and especially for guys, you know, where experience
Right, well, that was
going
going to be my next question. Do you see a lot of guys taking a proactive approach to this?
Definitely, definitely, and it's important, especially if you're a guy. It's important. It's important for everyone to get to the right person and to find someone who's conservative, but particularly for guys, because if you think about it, one of the qualities that makes men attractive is experience.
Correct.
So you don't want to erase the experience from your face, right? I mean, if you look at an ad for, there was a Chanel ad a few years ago with Brad Pitt, and he had 4 headlines, and he had crow's feet. You would never see a Chanel ad with Nicole Kidman with those lines, and I think there's not an expectation, but
it's the wrong messaging
more
that they're trying to send out. Also,
exactly.
the advertisement, I think they're trying to.
And there are things that make men attractive. There are things that make women attractive, and of course, experience is hot on women too, but in a different way.
All right. So, one thing I wanted to ask you about real quickly is the membership.
Yes.
Talk about that real quickly.
Right. So the membership was born of this idea, like I said, that I was trying to get all the tools together. I was trying to get away from the one-offs. I was tired of having conversations about how many units are we doing and how many syringes are we doing. I wanted to just come up with a total plan and just implement that plan over time.
Wow.
So I wanted to put everything together. So you're getting you're not just getting someone screwing a screwdriver, you're getting the architect of the plan and everything implemented over a 6-month period. And I also wanted to price it. I wanted to price it in such a way that it could be not a special occasion once, something that could be part of an anti-aging plan. And this is frankly how they do it I think the approach in Europe, in France in particular, is more maintenance.
Okay. Well, we are short of time, but I really wanted to thank you, and it's a great topic. Appreciate it.
Thanks so much.
All right.
Thanks for having me.
Okay, you're welcome.
Thanks.
All right, don't go anywhere. And when we come back, I'll share some of my favorite products to help you look good and feel great. Stay tuned.